Right, welcome everyone. Happy Tuesday. Dr. Stacy Holweger here. I am so excited that you decided to join us on this Tuesday evening, or if you're catching the replay. I am really excited about this interview tonight. Last week was International Women's Day, and I thought, how fantastic. Let's do a series with me interviewing women. Let's hear from female doctors and practitioners all over the country or the globe over the next several weeks. So, not just one day, we're going to make it several days. And I'm going to be interviewing an incredible doctor this evening with LifeWave that is going to be sharing with you her story, her personal experience, and also explaining the science and technology of how LifeWave works. And then she's going to be able to bounce back and forth with me and answer all your questions. So that way you get all the information you need this evening. But this is the first. So Dr. Jennifer Smith is going to kick off the first of a 4-part series in female practitioners and doctors sharing LifeWave's technology. So before we get started with that, I do want to make sure that you know that the information that we are sharing this evening is for informational purposes only. It is not intended to treat or cure or diagnose anything that's going on with you. If you have any questions about your health, if you're on medications or pregnant or nursing, please check with your practitioner. Neither one of us are medical doctors, and so we won't be giving any medical advice. Dr. Jennifer Smith is a traditional naturopath, and she's a certified holistic health practitioner and consultant with an expertise in resolving autoimmune conditions. We're not saying with the patches, we're just saying that is her expertise. And I know that is a buzzword right now that we're hearing a lot of. So I'm sure you're going to have a lot of questions around that. She's worked in the holistic health field for over 20 years with training in nutrition, herbalism, homeopathy, detoxification, aromatherapy, and of course, phototherapy. So, Dr. Jennifer, come on here and let's hear from you. Share with everyone your story. I want to hear your story. I'm excited you took time out to be with us this evening, and I'd love to hear how long have you been patching, what brought you to LifeWave, and what have you noticed?
Okay, well, thank you, Dr. Stacy. Yeah, so gosh, I actually I closed my practice 2 years ago. I just found myself in a position where I was working long hours, missing out on a lot with my family. I have two boys about to go off to college, and so I closed my practice and I started doing some part-time consulting work with for some medical doctors and other holistic practitioners. And by the way, you did mention that I used a combination of herbs, nutrition, homeopathy, and all that in my practice. I also used phototherapy, light therapy, and this is one of the panels that I had in my office. And it's funny, back in naturopathic school, I had to learn about the history of phototherapy, going all the way back to ancient civilizations, even back to the ancient Greeks in the city of Heliopathy, how they would hold up different gemstones to the sun and all that. And I remember thinking to myself, gosh, that how am I gonna use that in my practice? So I just kind of filed it in my short-term memory so I could pass the board exam. And I guess the joke's on me because here I am, and I did indeed use phototherapy in my practice. But after I closed and I was doing some consulting work, I just didn't feel I had any time for anything else. That's exactly why I closed my practice, was to spend more time with my family. And I was approached about this technology, and again, no time, but until I injured my back. So I sustained a pretty bad back injury about 15 months ago, and I contacted the person who tried to introduce me to the technology, and I bought a sleeve of IceWave from her. And let's see, those of you who aren't familiar with IceWave, here's what the sleeve looks like. And it brought my pain level down from about an 8 to a 2 in about 5 minutes. And that changed everything for me. Suddenly I had time to research this technology. I thought, if I can help get someone out of pain without the concern or the fear of addiction or overdose or liver or kidney toxicity, sign me up. So here I am. The rest is history. So that's how I got started in this.
Wow. And so you've been using LifeWave for 15 months, is that correct?
Yeah, yeah, about 15 months. And, I guess you might say I came into this maybe a little naive or maybe a little cocky because I
Mhm.
thought, well, I don't have any health problems. I'm just going to use this preventatively and, for longevity. That's what I was thinking.
Mhm.
And, I found myself over the months. Well, first of all, I noticed an increase in energy and deeper sleep. And I thought I had deep sleep. I thought I slept well, but yeah, my sleep got much deeper with this. And well, one thing that had happened to me that I didn't tell anyone, not even my husband, I had developed a vertigo over the
Mhm.
past few months prior to this, just out of the blue.
Mhm.
And just having these spinning sensations, and I just thought, oh, ignore it and it'll go away, and it didn't. And I must say I haven't had a single bout of dizziness since I've been patching. So that is gone. I've also had some things that, you just learn to live with over the years. I guess maybe I underestimated the power of this technology
Mhm.
because I have a curve in my spine. So my back has hurt me my entire life since I was a child. My feet have hurt me my entire life as well. And so I don't have that anymore, minimal, definitely smaller or more minor, I should say. Better energy, better mental clarity, and
Mhm.
gosh, no more gum pockets, which I must admit I didn't even know what they were. And but food kept getting caught on the upper left side of my gums, and sometimes my gums would get flamed and painful. That went away.
Mhm.
And gosh, another thing I noticed one day that my skin tags are gone on my neck. So just a lot of things like that. But I've just decided I'll never be without this technology again. I only wish I'd found it sooner.
I love that you say that because I was very much in the same situation with didn't have anything wrong with me, no health issues, conditions, and you kind of forget some things that you don't realize, or you think you're good. You're thinking it can't
Yep,
get
you
better than
learn to live with
this,
it.
right?
Yeah.
Same thing with you with the sleep. I was like, oh, I sleep great. I'm good to go. Except my husband would wake me up when he went to the bathroom. So thank God the patches helped with that for him in the middle of the night. But I'm like you with the sleep, like you sometimes I'll wake up and I'm like, where am I? Like I was asleep so deep. Am I alive? Because you don't even remember sleeping. There's not 1 ounce of movement. And like you said, I didn't think about skin tags, but I had some of those too. And so there's this
Yeah.
little bitty baby things that you didn't have when you were in your teens or 20s, right? We
Hmm.
didn't deal with those little things. But
Right.
obviously, the curvature in your spine you did, but to be able to have the relief in that and your feet, and it's like almost like, how can it get any better?
Yep, exactly. So yeah, again, I guess I just underestimated it. So now I am more cognizant of my body, and I'm just noticing more and more all the time, more and more improvement.
Yeah, body awareness. We talk a lot about that because a lot of times when people are not in great health, as you see in your consulting in your practice, their health is so poor that there are so many things on their list. They have a hard time identifying what's doing what or what's causing what or how to get to the root of that. So I would love for you to talk about explain, briefly how our technology works with LifeWave's X39 patch to be able to really help get to the root of what's going on. So do you mind sharing with us how the patches work?
Sure. Yeah. So this is our foundational patch here, about the size of a quarter. Doesn't get any easier than that. And we wear it 12 hours on, 12 hours off while we're fully hydrated. I am the hydration queen. I've been preaching about hydration for years and
Mhm.
years. And so yeah, the patch, you can wear it in multiple places on your body, just about anywhere it's going to work. And it elevates the GHK copper peptide in the body, which does so many things, resetting your genes to a younger, healthier state, and cellular activation, and just all kinds of things from reducing pain levels to improving sleep, all the things that I thought I was fine with,
Mhm.
increasing mental clarity. There's so many benefits to increasing your endogenous levels of GHK copper peptide.
Mhm.
And copper peptides or peptides in general are really all the rave right now. But I'm just not one to get exogenous injections of anything that I don't have to. So when
Mhm.
I learned that you could elevate that on your own, I was sold. It just this technology, I still can't believe I didn't know about it sooner. And so by elevating that copper peptide, you can resolve so many health conditions in the body. It's just really a matter of time. Some people are what we call a one patch wonder, and they'll apply the X39 patch, and within a few minutes, a few hours, a few days, they're feeling great, years worth of symptoms gone. And other people, it can take a while. And so, I often tell people, while you may be using the X39 patch to repair and regenerate your injured shoulder, for example, what you may not realize is you may have a toxic fatty liver, or you may have a failing kidney, or you may have a heart condition or something else going on in your body that you don't even know about. So even though that injured shoulder might be keeping you up at night, preventing you from working in the yard or doing the things you love to do, even impairing your ability to drive, it's not as life threatening as what's going on in your body.
Mhm.
And so despite all of the fancy blood tests and scans and everything they've got now, only God really knows what's going on in your body. And so by reactivating, cells and waking things up in your body, it's going to go to what's the most important, what's the most life-threatening going on in your body. So it's going to fix those issues first. And it may be your shoulder, it may not be, but I always tell people just give it time. And I hope you can be a one patch wonder like so many others are. But if it's taking more time, rest assured it's still working.
I know. I love that because that is, when you're in pain or when something's really wrong or you have many things wrong, you want solutions, right? People want solutions now. They want these things fixed. And they're coming to us saying, as many of you guests are on here tonight, we're approaching 500 people here tonight, Dr. Jennifer. And so those people, no pressure, no, no worries. It's fine. It's just me and you. That's it. Just the two of us. But there are a lot of people on here tonight that are saying, I need a solution now. I need something immediately. And so when we say to them, you're going to have to give this some time. It may work for you sooner with the elevation of that peptide, but yet when you activate those cells that are responsible for repair and regeneration, it can take longer. And so we see some of the things you mentioned usually in our clinical studies in the first 3 to 6 weeks. We can see those changes neurologically. We can see changes in pain and sleep and things. Sometimes it takes 3 to 6 months. But I love that you mentioned peptides are all the rave. They are. I have a 19-year-old that is obsessed. He's been patching now for 3 years and he's obsessed with peptides and working out and looking at what all the natural bodybuilders are using, but he refuses to come anywhere near a needle. Like it's absolutely will not ever, ever, never, ever, ever happen that a needle will enter his body and never has. It's absolutely no for him. And there are a lot of people in that situation. They can't afford those injections or they don't want something invasive because every time you enter the body, there is a risk. There's
That's right.
always a risk when you enter the body, right?
Yeah.
Especially with a needle. And so you have to weigh your pros and cons on that. But that expense and the time going to get the injections and whatnot, that's not able for everyone's not able to do that. And so with our patch, because it is accessible, anyone can get this little round band-aid, a pack of them, right? Shipped to their house. Apply this in the morning when you get up and brush your teeth. Like you said, leave it on 12 hours, take it off, throw it away, and do a new one the next day. And it doesn't have to go right here at the center of your chest. It can go anywhere you want. Like you said, anywhere works as long as you put it on your body, leave it on, and stay hydrated. So those are some really good key points that people need to understand about time. And we normally say 1 month for every decade you are old to kind of get those cells woke up and active and doing what they need to do again. So if you're in your 50s, 5 months, 66 months, and so on. But again, you can't, the key things that I want people to understand, you can't know what is really, I love that you said that. God knows, but there may be MRI. I can't tell you how many MRIs and CT scans we would have with my daughter when she was little in the hospital. And the surgeon would go in after the scan and go, didn't look like that when we went inside. So
Mhm.
we thought we were going to remove this part, but yet we didn't need to. And I'm like, you just did an MRI. Like, how
Yeah.
can that not be what you saw when you opened her up? Thank God it was always in her favor. God was always in her favor, of course. But that's what people need to realize too is we don't really know what's going on inside, but our body does. God created us to repair ourselves and to get into balance. So when we talk about that, getting to the root of the problem, what do you find with people in, let's say, like for you, for example, with your back, having the curvature in your spine and having that pain since you were younger? Do you find that people, it takes a certain amount of time, or do you find that, again, like everyone's different? Or do you mentioned ice wave? What would you suggest in that situation with a pain, back pain, shoulder pain, knee pain, for them to be able to use to be able to get that relief like you did on day one?
Okay. Yeah. And again, I knew very little at that point about this technology. All I knew is that I was in pain. I had a rib protruding from my back that my husband could not only feel but see.
Mm.
And my chiropractor was out of town naturally.
Hmm.
And so all I had was Ice Wave. That's all I had. I didn't know much more about it. But, moving forward, the more I learned for someone with a painful area like that they've dealt with for a while, I would recommend Eon. Gosh, I'm sorry, Ice Wave for acute pain to help get them by while X39 and Eon can go in and do the repair and regeneration work. So it really does depend. I mean, like you said, we're all different, and pain is complicated as well. There are a lot of factors that go into pain. There are a lot of different types, a lot of different causes of pain as well. So I do find that proper hydration again is key, and then the trio of Ice Wave, X39, and Eon work so well together. And I've only had to use Ice Wave probably 7 or 8 times since then. And in fact, once was today. I fell. I cannot believe this. I fell out back on my slate patio and I banged up my wrists. I braced myself with my wrists. I
Hmm.
banged up my cheek, my feet, everything. And, my head hurt pretty badly after that. And so I placed my Ice Wave on my temples,
Hmm.
right on white, tan on left. And fortunately, I have other patches on. And so I know that I will heal more quickly from that. And you can't even tell. And it was a pretty hard fall. But yeah, we're all different. There's pain that comes from different health conditions, from different injuries. It can even just be pain caused by, emotions, by poor diet. So it really depends on the type of pain, but I love those three.
Okay, I totally agree with that. Those three are hands down. You know that ice is going to do the trick. You got to move it around sometimes. I'm a
Mhm.
big proponent of the white right, tan left, like you are.
Yep, me too.
That's just start there. Just start there. You can definitely figure out the right side of your body and the left side of your body, usually. And so we can do that. But if you need to move around clockwise, that's always an option too. But let's use that X39 and neon so we can get down to the root of what's going on. That's key. So someone was asking, what patches did you use for your dizziness? What were you using at the time that helped that to kind of go away?
It's funny. I know that, and I do this myself. I preach, don't let this overwhelm you. X39 and Eon are a great place to start, the dynamic duo.
Mhm.
But it didn't take long. I dove into this head first. I'm a digger, I'm a researcher. And as I researched, I think I used X39 and Eon for maybe 3 days. And then I was like, I want it all. So I just started using all the patches. If I had to guess, though, I would say X39 and Eon is really what did it.
Yeah.
But I
Well,
use
we know
multiple
that.
patches every single day.
Yeah, I do too. But we know that Eon brings your nervous system into balance. And so when you can balance that nervous system, a lot
Mhm.
happens. It not only brings your inflammation down, but the nervous system is so important. And that's important for your body to be able to heal itself. We can't heal if we're stuck in that fight or flight mode. So
Right.
helping the body physically, but also helping the body mentally and emotionally to get into that calm state definitely helps. with
Mhm.
those things as well too. So
Yeah.
I've got some questions in the chat. I would
Mhm.
love to be able to kind of go back and forth with you on those questions. Now, you mentioned that in your bio that you specialize in autoimmune types of issues and conditions. So, without getting into any of those specifically, can you kind of give us what is your definition of an autoimmune, or what is happening inside of the body when something is out of whack in that situation?
Okay. Yeah, well, autoimmune conditions, it's really an umbrella term. There are about 200 conditions that fall under the
Mm,
term under the umbrella term of autoimmune. And the mainstream, the medical establishment describes autoimmune conditions as the body attacking itself. And I don't really subscribe to that theory. I
mm,
don't believe God designed our bodies to just self-implode. I think our bodies are really protecting our vital organs and things from foreign invaders. And, whether it's autoimmune or other health conditions, I've found over the years that almost every health condition boils down to two things: toxicity and deficiency. It's really that simple. And there are many different forms of toxicity, and when you think about it, half of what Americans eat, clean their homes with, breathe in, apply to our skin, and what's sprayed in our clothing, half of those ingredients are banned in other countries. That's frightening. And so many, many different forms of toxicity, including toxic emotions.
mm,
So lots of forms of toxicity and lots of types of deficiencies. So we tend to think of nutrient deficiencies, which that's a big one, and lots of reasons for nutrient deficiencies, ranging from medications cause nutrient deficiencies. And then let's face it, our food is just not as nutritious as it used to be. The soil is deficient. A lot of our food is genetically modified. There are all kinds of artificial, crazy ingredients. And so a lot of deficiencies there, but there's also sleep deficiencies, exercise deficiencies, hydration deficiencies, love deficiency. I've had people come to me and they just broke down. Nobody loves them. And that's a lot. So toxicity and deficiency is really what I see is at the root of a lot of these conditions. So I believe that when you restore the body back to balance, homeostasis,
mm.
the body heals itself, because I firmly believe our bodies are designed to heal themselves naturally with the right tools.
Mm.
And so this technology is, of all the tools I've used over the years, this technology is the most powerful. It does things I've never seen before.
Wow, that's an excellent explanation. I'm sure a lot of people are going to appreciate that. Toxicity and deficiency. And
Really
there's
that simple.
lots of variations in all of that. So you almost can kind of go, wait a minute. Well, I'm going to have to live in a bubble, right? I'm going to have to live in a bubble. I'm going to have to be tube fed with all of this stuff. And we don't obviously have to go to that extreme, but it can be daunting and overwhelming. And I love that you said with this patch, it does so much more than you actually realize it does. And I
Mhm.
don't think people really realize the biochemical reaction that takes place inside of the body when you activate a peptide.
Yeah.
So
Yeah.
when you activate GHK, that chain of events of reaction, the things that happen inside of the body continuously, day after day, week after week, month after month, it's almost kind of like like a 5,000 piece puzzle. And
Mhm.
you're looking at it going, there's no way I'm going to get this together, right? It's not going to happen in my lifetime. And then all of a sudden, day by day, you work on it week by week, and all of a sudden, this puzzle comes together and you have this masterpiece at the
That's
end.
right.
So when you're talking about patches, simplicity is key for people, right? And
Yeah.
so we always start with X39, but when we're looking at toxicity and deficiency, what patches do you recommend to people to help with those two issues that we know everyone is dealing with in some way?
Gosh, well, I love glutathione. Love it.
Mhm.
From a toxicity standpoint. And, I've always been a fan of glutathione, but let's face it, the forms of exogenous glutathione that we can get aren't ideal, really. You can get an IV of glutathione, and that only has a 7-minute half-life. It's invasive, it's expensive, and if that molecule size isn't just right, it's not going to permeate the cell membrane and go where it needs to go. And I also have concerns about the source of that glutathione and what else is in there. Is there aluminum? What else is in there? And so you can also get glutathione capsules, but your stomach acid eats up about 80% of it. There are glutathione suppositories. No, thank you. And in my office, I used to carry a nanoemulsified and liposomal glutathione that you squirted in your mouth. And, it was expensive. It had to be refrigerated and it tasted horrible. Like everybody hated it.
Yes.
So yeah, again, when I found that you could elevate your own endogenous levels of glutathione, your body's master antioxidant, your master detoxer, and you could increase it by an average of 300% over a 24-hour period. I couldn't hardly believe it. That was incredible to me. And glutathione is particularly known for helping to detox things like pesticides, heavy metals like lead, mercury. There's so many forms, so many heavy metals that we've got in our bodies that people just don't realize.
Mhm.
And a lot of pathogens, pathogenic infections that are also at the root of autoimmune conditions, they love to feed on heavy metals.
Mhm.
So I always tell people, starve them of their favorite foods and feed them the foods that they hate. So glutathione can help the body rid itself of things like heavy metals and pesticides and things that pathogens love to feed on. So I love glutathione from a toxicity standpoint. I also love carnosine.
Mhm.
And so while glutathione is especially known for helping the body release heavy metals, carnosine is especially, it kind of has an affinity for aluminum, a lighter metal. And so a lot of neurological conditions, one that my grandfather passed away from is associated with aluminum toxicity. And so I wish I'd known about this technology back then. I'm sure we've all said that before. So glutathione and carnosine from a toxicity standpoint. But as you know, those two patches have so many additional benefits besides detoxification.
Oh, yeah. Organ benefits.
Yes,
When you look at
yes.
the kidneys and the liver and the pancreas, your intestines, your heart, your brain, they do so much to benefit those organs. We
Mm,
have the other patch in that Y age series, the Eon, which we've mentioned already. Those three patches David invented over 15 years ago, and they're called Y with a Y age patches. And the whole point is keeping your body detoxified, keeping the inflammatory markers down, the nervous system in balance, keeping those organs healthy. You're going to live a lot longer. And I'm sure you experience this too. I always reference our bodies to a car. And there's no way you would have a car and never change the oil. It would not
that's right.
function for you. But yet people are terrified of detoxing. They think they'll be on the toilet, they won't be able to go to work, they may have a headache or be tired or fatigued, and so they just don't do it, and then all of that piles up, and now they're paying on the back end for that lack of detoxification. Do you
That's
find
right.
that as well too with people?
Absolutely. I often say all roads lead back to the liver.
Mhm.
The liver is so important. And I know there's a lot of talk now about gut health, which is great. I'm glad about that. It's very important, but the liver, that's key. And again, we've got so much assaulting our livers. I'm convinced that half of America is walking around with non-alcoholic fatty liver disease and they
Oh,
don't
yeah.
even know it.
Mhm.
But that is at the root of a lot of health conditions. And so just cleansing the liver, just like you would change the filter in your car or your air conditioner. We don't think twice about doing that.
Right.
But we don't maintain our bodies well in America. We don't think to do anything until we're sick, and at that point, I say it's never too late, but why not be proactive about it?
Yeah. And
So,
so if you've
and get
never
other
done
benefits
it,
at the same
it
time.
so say you've never done a detox, or you're worried about using glutathione and carnosine because you don't want things to detox too fast where you have to have any, bad experiences. And you're like, well, you're already feeling pretty crappy as it is with the stuff you're dealing with. So better out than in is what I always say. But
Yep.
what would you say to someone that's, kind of hesitant if they don't want to have a headache, or they don't want to have, a couple extra trips to the bathroom? Not that that's necessarily going to happen to everybody, but sometimes it might. I know you've mentioned hydration. What do you recommend with that for people?
Well, for glutathione, for example, glutathione is no joke. It's a serious patch, and I experienced this with my husband, who was involved in a pretty serious accident a few years ago, which resulted in multiple surgeries with general anesthesia and everything that goes along with that. So I thought, great, this will be a simple way for me to help detox him without a whole lot of effort on his part.
Mhm.
And so I started patching him up, including glutathione, and I didn't stress the water enough. So
Mhm.
water was key. He felt a little woozy by the second or third day, and I figured out that he was not drinking anywhere near enough water. So yes, that can't be stressed enough. But also someone who is concerned about having a reaction, I would recommend to use glutathione, maybe every other day, or you could wear the patch, maybe just remove half the backing, because those of you who have not used this technology yet, you'll find that they're slit. The patches in the back are slit down the middle, and you can peel off just half the backing and wear the patch for maybe 2, 3, 4 hours, whatever you feel is right for you. Then remove that patch, place it in a glass, just like a glass you drink water out of, and
Mhm.
place a towel over it so that it's not exposed to direct heat or light. And then the next day, maybe wear it for a few more hours, that same patch. And so I've recommended that to people before, but anytime I've ever known of anyone who had a rough time with glutathione, I think almost every time it boiled down to not enough water really was the
That's
key. So may want to drink extra and just cut down the number of hours and then gradually work your way up to 12 hours on it.
Yeah, I love that because the key is to get it on your body and get
Yep.
that glutathione level elevated. So if you do it a couple hours a day, or if you do it once or twice or three times a week, at the 12-hour mark, whatever works for you, we're all going to be different. There's no two people on this planet that have the same level of toxicity in their body, physically, mentally, emotionally, and spiritually. It just does not happen. And we know all four apply inside of the body with what's manifesting and what's happening. So hydration, I always say half your body weight in ounces.
Me
Consuming
too. Yep.
alcohol
I've
or caffeine, you're going to have to
I
balance
I
that and
say
drink
those
more.
exact things. Yep, yep. If half your weight in ounces per day is almost a starting point, and if you drink alcoholic or caffeinated beverages, then you need to drink even more water to make up for that, which is depleting you. And I'm also been a big fan of electrolytes for years.
Mhm.
I noticed a few years back that even people who do drink a fair amount of water were becoming dehydrated. It wasn't getting into the cells where it needed to be. It was
Mhm.
just kind of going right through them. And so I did some research, and I'm convinced that it's because of the just constant barrage of EMFs that we're exposed to, especially the 5G, because 5G has a direct impact on water absorption in our bodies. And so electrolytes can really help with that. And you and I are on the same page. I typically just make my own electrolyte drink. A lot of times I'll put a little Celtic salt in some water, maybe a little squeeze of fresh lemon juice, maybe a couple drops of honey, stir that up, and that makes a nice electrolyte drink. And when I'm on the go, I carry the little sleeves of a brand that you can get easily in places. Unlike the more common brand that starts with a G, the brand I use does not contain any no artificial colors, no artificial flavors, no artificial sweeteners. But getting some electrolytes in at least one or two of your glasses of water per day is really going to help with conductivity and cellular communication, which is so important.
Totally agree with that. Huge proponent of electrolytes. People are so deficient,
Mhm.
especially in that potassium, magnesium, and their
Yeah,
salts, the wrong kind of salt. So I'm a huge
right.
proponent of Celtic as well too. So we talked a little bit about the detoxification. Can you talk a little bit about deficiencies? What are your thoughts on that with deficiencies? Because we know that our patches are not going to elevate your vitamin D level. We don't have a patch for vitamin D or a patch for vitamin B per se, or your multi or whatever. How do you address that with people? Or do you even address it with the patches? Is there something else that you are used to or accustomed to sharing with people?
Well, I tell you, in the past, one of my favorite tools in my tool bag is I love a good quality greens drink.
Hmm.
An organic, it's always made out of freeze-dried fruits and vegetables. And the good ones are going to contain some chlorella and spirulina and, different microalgae and things. So it's good, highly absorbable nutrition.
Hmm.
And also looking at what's causing nutrient deficiencies. And so, like I mentioned before, a lot of medications, I mean, almost every single medication has a what they call drug-induced nutrient deficiencies or nutrient depletion, I should say. So you can look that up online. So, for example, you know, um, gosh, I'm trying to think of the generic name. I'm just going to say prednisone is kind of notorious for depleting vitamin D levels.
Hmm.
That's just an example. And so figuring that out, and I would never tell anyone to stop taking a medication, a pharmaceutical drug. I mean, that's between you and your medical doctor.
Hmm.
However, you may want to have that talk with your doctor and just say, are these medications that I'm on, are they necessary? Do I need all of them? Can I remove any of them, or can I reduce the dosage? And that can make a difference as well. And I'm also finding that, these patches, especially with X39, just what it does for the body, the cellular activation, that alone is going to require not only less medication, but I find that it helps with deficiencies. It just does. For one thing, when you're repairing things like poor gut health, that alone, that's going to help with nutrient deficiencies. And just overall, the way you feel, because toxic emotions can drag us down. And I'm sure you've heard it
Hmm.
too. I have people that I've introduced these patches to, and they've come back to me a few weeks or a few months later, and they're like, I don't know how to explain this, but I'm happier. I
Hmm.
feel better. I have a better outlook on life, all those things. And that definitely impacts our nutrient absorption. When you're not feeling well, when you have a bad attitude, when you are depressed, whatever, it's going to impair your body's ability to absorb nutrients. And then, of course, just proper diets. And some of that is almost impossible. Some of it is common sense. Some of it is just a matter of willpower. I mean, I love me some pizza myself, but I
Hmm.
try to I
Yeah.
try to go for the higher quality and a little less of it.
Yeah, I agree. I love that. So, not necessarily that it's a patch that does this vitamin or this mineral, but bringing your body into balance, helping restore
Right.
the gut function, the liver function. The body's
That's
able to absorb the nutrients from the food, the healthy green food, the healthy food that we're eating, whatever that color may be, and be able to help our body assimilate those nutrients so that we aren't in
mhm,
deficient mode all the time. And being mindful, I'm sure, like you, myself, nutrition is our foundation. We've got
right.
to really get rid of everything processed, packaged, dry, freeze dried or, frozen, canned, full of, all of this stuff that's not even really food, and really look at, the things that you can go outside and kill. All
That's
right.
right.
Or the things that you can grow. Pick one
Yep.
of those two
Blood of a tree.
categories.
Well, exactly. It's really that simple. And if you're not in a position to grow any of your own food, I mean, some of us just aren't, depending upon
Yeah.
where you live, or, if you're working two or three jobs or whatever the case is, shop the perimeter of the grocery store. I'm sure you've heard that before. The interior of the grocery store is where you're going to find the processed packaged food, and avoid things with ingredient labels. A package of broccoli doesn't have an ingredient list, where a package of cookies or potato chips is
Veggie
going to have a list a
straws. How
mile
about
long.
veggie straws? Did you see the review on that? There's not a vegetable in there.
That's right. That's right. They might be veggie colored, but that's about it. That's about where it ends.
Yeah, with fake artificial colorings. Oh my gosh.
You're
So
right.
that's an excellent explanation. Thank you for going into that because I know that's going to help so many people. So we have some questions in the chat. We've got about 20 minutes. So I'm going to pop through these pretty quick. If you don't mind sharing your recommendation, if you could, on a patch or two, if that's
Yeah.
okay with you, that they could
Yes, of
utilize.
course.
We know X39 Eons are foundation. You guys know that. So if someone has, the woo, I'm hot all the time, I can't get my body in check there, they're ripping clothes off, putting them on, what other patch would you use besides 39 and Eon?
Well, of course, SP6. So, and SP6, people call that the weight loss patch. And I almost cringe when I hear that because to me, weight loss is really the side benefit of it. Really, what SP6 is designed to do is balance the endocrine system. So, your endocrine system is, think hormones, thyroid, adrenals, all of that, your endocrine system. So, by virtue of balancing the endocrine system, then the end result can be reduced cravings, it can be reduced hot flashes, it can be weight loss, reduced appetite, and then also, of course, avoiding things that cause hormonal imbalance, such as, plastics and synthetic scents and all those things. It's so hard for me to remove my naturopath hat, but yeah, I also love Eon for hormone balancing as well. And Eon, gosh, I talk a lot about the autonomic nervous system. You've got those two branches, your sympathetic mode, also known as fight, flight, or freeze, and parasympathetic, also known as rest, digest, repair. And a lot of Americans, we tend to get stuck in that sympathetic mode, and it's just due to our modern lifestyles. We're constantly, on social media or the 24-hour news cycle or 6 lanes of traffic or mean bosses. We work inside too much. We don't get outside in the sunshine and fresh air and things like that enough. So we tend to get stuck in that vigilant, that sympathetic fight, flight, or freeze mode. So by putting the autonomic nervous system in balance, that makes a big difference because I find when you're in sympathetic fight, flight, or freeze mode, your adrenal glands are secreting cortisol and they're just feeding that. And a lot of times that can trigger other hormones. And in America, we tend to think of just estrogen and testosterone. Well, you've got about 100 other hormones in your body that all work in perfect, beautiful symphony together, or they should. But with all these other things that we're artificial things we're putting into our bodies and constant stress, that's what throws it off. And so I don't really look at hot flashes as a normal part of aging. It shouldn't be like that. So looking at the things that cause it, and cortisol stress is one big trigger. So I love SP6 to help balance the endocrine system, and I love Eon to help balance the autonomic nervous system. To help, again, it's all about balance,
I love that.
homeostasis.
Totally agree. And I'm the same way with you. When people say, oh, it's your weight loss patch, I'm like, what? We don't have a weight loss patch. No, that endocrine system is out of whack. Yeah, when you
Right.
bring that into balance, have you ever used Alavita at
Oh,
night? Can you share that a little bit?
love Alavita. I will never be without Alavita. I don't care if I have to live in my car to afford it. Not that it's not even expensive, but oh my goodness. I love Alavita. It is a nighttime patch because it elevates our epithalamin levels in our pineal gland, and also helps elevate a small amount our levels of melatonin, which is our sleep hormone. So that's why it's recommended to be used at night. And it's the skin patch, but not just our exterior skin, which I say just. Our skin is really important. It's our largest organ. It's our first line of defense against foreign invaders. And it's also our last, it's one of our 5 main detoxification detoxification pathways. We excrete toxins through our skin. So our skin is very important. And so we tend to think of skin in America as just, a vanity thing, which who doesn't want to
Right.
relieve wrinkles and scars and age spots and things like that. So I love that about Alavita, but also not only fixing our exterior skin, but our interior skin. So think gut lining, think of even esophageal lining, things like that. But I actually call Alavita the trophy wife patch. My husband's a little younger than I am, so I have to do what I can. And it's funny, a few years ago when I was 52, I told my husband, I said, gosh, I better get my act together or you're going to trade me in on two 26-year-olds.
Oh,
And so here, here this technology fell in my lap, and I'm older than 52 now, but Alavita, among other things, extends your telomere length. And when I found that out, I could not believe it. So your telomeres are the ends of your chromosomes in your DNA. And as we age, they tend to shorten. And, if you can even maintain your telomere length, that's doing good. That's great. It's directly tied to longevity. But the fact that Alavita actually extends your telomere length, that is incredible. So because of that, Alavita is the second most powerful patch next to X39. So it is definitely a favorite of mine. It's something I will never be without. So highly recommend that.
yeah, I'm actually reading the book called The Telomere Effect right now. And
Okay.
it's by two female doctors, and it's really, really good. I'm about halfway through it, so I'll definitely give
Oh,
my recommendation. But it's
I will
easy
have
to
to.
understand. But man, they talk about even being in utero and what your mom and obviously dad contributed to your telomeres and what
Wow.
you can do to be able to help support them. And we know that carnosine protects the telomeres we have. So that antioxidant is protecting what we have, but to lengthen your telomeres, previous to LifeWave, in my experience, it was meditation.
Yeah, right, right. That was
You need to
it. I've never
meditate
heard
for an
anything
hour a
else.
day, every day to lengthen those telomeres. And I was like,
Yep.
man, I'm going to live forever. Like I'm going to have to meditate every day. And sometimes you just can't get it in, right?
Right,
Well, I can't, an hour, right? Is like crazy time. Get up an hour
right.
earlier. But you think about longevity. And so I love that we can see that impact with our patch, with the Alavita in the pineal gland and what's taking place. And again, that chain reaction in the body, that biochemical reaction is, it's really, impacting our cells, our DNA, our chromosomes, and how our body is not only responding to oxidative stress. We know that patch decreases
Mhm.
oxidative stress, which is, that apple that's fell off the tree a week ago, you would never pick it up and eat it. That's what your insides look like when they have oxidative stress from the things you've already mentioned, right? Those deficiencies and those toxicities.
Right.
And so that patch is so important. So we do talk about it for our skin and how it benefits our skin. And, being that, ooh, I love that trophy wife patch. I'm going to start saying that. Laura's dying. We're like, ooh, hashtag trophy wife patch. Can we even do hashtags anymore? I don't even know. That was about 10 years ago, but it sounds like it would be perfect. We should do that. Trophy. That's it right now. We're going to hashtag this on YouTube, trophy wife patch. It's going to go viral. But you guys, that is really important for all over longevity that we're impacting our body at that cellular level. So I love that you shared all that about Alavita. We know that Alavita impacts the organs as well too. We can see that in our clinical studies, those female reproductive organs, male reproductive organs. This is not, I had somebody ask earlier, they sent a message and said, would this Zoom tonight be appropriate for a man to join on? And I'm
Oh,
like, that's like asking, would it be appropriate for a female to listen to me interview a male practitioner? Yes, of course it's appropriate. It's all going to be applicable, and here we go. How many men want a trophy wife? You need to be making sure your wife is patching with Alavita every night, right, Dr. Jennifer? We heard
that's
it from
right.
you. Oh, I love that. That is great. Okay, so we've got a lot of other questions. We're going to try to get through a few of them in here, but a lot of people are asking about logistics. So you said 12 hours on, 12 hours off. They want to know why 12 hours. why can we not reuse the patch? And how does that work
Okay.
logistically? Yeah.
Yeah. So, just choosing a 12-hour window that works best for you, for your schedule. Personally, I choose 10 to 10 because that's by 10 a.m. That's when I've done my thing, whether it's going to the gym or whatever. I'm bathed, I'm clean, I'm well hydrated, and I'll apply my daytime patches at 10 a.m. And then at 10 p.m., I'll remove my daytime patches. I apply them to my little dog,
Mhm.
and then I'll replace them with my nighttime patches. And I personally, I wear Alavita at night, and I wear Eon at night as well. Even though Eon can be worn day or night, I just found that I was wearing quite a few patches during the daytime and only one at night. And so I started applying Eon to the curve in my spine,
Mhm.
and I wake up pain free every day. So that's what works for my schedule. And after 12 hours, you have the option to either toss them in the trash or you can apply them to your pet, which a lot of us do that. But there's a phenomena in phototherapy called attenuation that occurs if you get too much of it. If you just constantly sit in front of an exogenous phototherapy light, like what I showed you earlier, or you use this form of phototherapy, it's after a while your body's not going to be responsive to it anymore. And so that's why the 12 hours on, 12 hours off. And also the patches start to break down after 12 hours. There is still something left in them, but
Mhm.
not nearly as much. So 12 hours on, 12 hours off. It's really that simple while you're fully hydrated and with some electrolytes.
I love that. I agree. So if someone has went through like chemotherapy, radiation, right? They've had severe toxicity and
Mm,
damage to the body on all these different DNA and cellular levels.
right.
What would be your recommendation for them to start patching after treatment? They can
Oh
patch
boy.
during the process if they want to, of course. A lot of our clients do, but what would you recommend to really help? They're post. They just finished, so they're like, okay, now what do I do? New to the patches. What would you recommend to help them, their body to recover?
Gosh, I'd recommend the Fab Five,
Mm,
which is X39, very foundational. And that just reactivates, cellular reactivation and just kind
mhm,
of wakes things up again, brings things back to life to repair and regenerate. X49, and a lot of reasons for that, but I know we don't have a whole lot of time, but I will say a common occurrence when cancer reoccurs. Oftentimes it goes to the bones. And so, one of the many side benefits of the X49 patch is it increases bone density. So, that's just one of the reasons. Eon for reducing inflammation, balancing the autonomic nervous system, so many benefits with Eon. Glutathione
mm,
for, detoxification and other benefits as well. And carnosine, again, many benefits to carnosine. Your body has been through a lot when you go through those treatments. And so you want to repair and regenerate and nurture your organs,
mhm.
rid the body of aluminum, things that are in the treatments, and repair the blood as well. So I think of anything to do with the blood, just about. I think carnosine, whether it's balancing blood pressure, blood oxygen levels, that's a big thing also. Balancing blood sugar. So those are the ones that I would recommend. Is again X39, X49, Eon, glutathione, and carnosine.
Perfect. Thank you. Great recovery, repair right
Yeah,
there.
yeah.
So let's kind of take a little spin off of that carnosine. We have about 6 minutes left. So we have some people asking about blood sugar issues. If our blood sugar is elevated, that resting glucose is over, 99, what would you say to help them bring that blood sugar back into a normal level?
I love SP6 and carnosine for balancing blood sugar levels. Again, you're talking part of the endocrine system. And so think SP6 for endocrine and think carnosine as well for the blood. So I love those two patches together.
Awesome. Wonderful. Okay, so they're asking a little bit more on the 49 because we haven't really dove that deep into that, which you did here just now with the bone density. So what is the difference between 39 and 49?
Okay, so X39 helps elevate and activate your body's GHK copper peptide,
Mhm.
where X49 helps elevate the body's AHK copper peptide. So the A and the G, it's alanine versus glycine. AHK is the daughter peptide to GHK. So those are really the two differences. Your endogenous levels of your endogenous AHK, alanine, I should say, is mostly found in the muscles, but in other parts of the body as well, in the heart and in the brain. And I would say that X49 is just a little more targeted than X39. So X39 is more broad spectrum. It can do a lot for the body. It may take a little more time to do some specific things you're looking for, but it can do so much for the body. Where X49 is a little more targeted for the neurological system, cardiovascular system, the muscular system, for athletic performance. So that's why athletes love to use X39 and X49 together. The two work so synergistically together. And then, the bone density, increase in bone density. I've known of quite a few people personally who have reversed certain diagnoses related to the bones.
Mhm.
And the reason I wear X49 every day is because it helps protect you from EMFs, harmful EMFs that we get from our phones, our laptops, our smart TVs, our Wi-Fi, and of course 5G. So it kind of acts as a Faraday cage for the body, and protects your cells from that damage caused by it. So yeah, I would have to say X49 is just a little more targeted, but both are great. We love them both.
Hmm. So they're asking a little bit more about brain memory, things like that. So we only have like 2 minutes left. You can go back to November on my YouTube channel. I actually spent 4 weeks with a medical doctor named Dr. Don Verholst. I'm sure you probably have seen him
Mhm.
on my channel before. And he and I dove deep into the brain and into neurological and the patches and what they do and how they work. So we don't really have time to go that much into all of that. But when we look at neurological, X39, you just mentioned X49 for
49.
its neurological benefits. Because that peptide AHK, it has an affinity to the brain and to the heart and to the muscles and to the bones. It's just different peptides do different things in the body. But we also know that Eon, bringing the nervous system into balance, is really going to help. Bringing the inflammation down is really going to help that brain. Eon is huge for the brain, and carnosine. I know you're going to hold that up next, right?
Mhm.
Yeah. So tell us a little bit why you feel like carnosine is important for the brain. I know you mentioned earlier that just if you would Google carnosine as a nutrient or go to PubMed and type in carnosine, you can find that carnosine helps to detox aluminum. So let's just touch on that real quickly here while we've got about a minute left.
Yes, yeah. So aluminum, when a person passes away of certain neurological conditions, if an autopsy is done on them, their brains are always full of aluminum. So
Mhm.
that's important to help get that out. Also, carnosine can help balance left and right brain hemispheres. So that's important too. So I think those are the two biggest things with carnosine as it relates to neurological health.
Yeah, and people, initially when David released the X49 2 years ago, he was thinking, would this maybe replace the carnosine, or is there going to be a need for both? And of course, we know that X49 doesn't impact the organs like carnosine does at all. Doesn't have that same tissue repair component. It has a component of helping to reduce pain. So they do different things. And when you dive deeper into the brain information we shared, when you trigger a peptide, as we mentioned, that biochemical reaction that takes place goes down a different pathway, different things are impacted. So if you kind of picture dominoes falling, whoop, you're going one direction with those dominoes with X49. Carnosine is going a whole different direction. It's totally different
Right.
dipeptide,
Different
right?
pathway.
Totally different pathways. And what they're doing, they work individually, but they also work synergistically. And so you can multiple patch with different patches to be able to help benefit one area, right? So we're right at 9 o'clock, Dr. Jennifer, and I just wanted to tell you how grateful I am for you coming on here tonight. You and I totally resonate with everything. I'm going, yep. I'm so grateful that you took the time to come on here and share with our audience of people in our organization that are, learning about patches for the first time, or maybe they've been in for a while and they're hearing new things. I know you and I are lifelong learners, readers, listeners, and we're always devouring information, like you said. So, what would be some last few minutes of information, little bits of information you'd want to share with everyone as we wrap this up?
Gosh, if you're just getting started, X39 and Eon, you can't go wrong, the dynamic duo. And gosh, just being mindful of toxicity and deficiency and all its many forms. Hydration is key, and emotional health as well.
Wow. Thank you so much. This has been incredible. We hit over 505 people tonight. So thank you so much, Dr. Jennifer. I appreciate
Thank
you.
you for having me.
Absolutely. I'll see you at an event soon.
All right, take
Thank you
care.
all.